By 2043, Japan's population of older adults is projected to peak at 39.53 million. As this cohort expands, a structural friction point emerges. Adult children are highly concentrated in urban centers, often commuting long hours and living far from parents residing in care facilities. Frequent physical visits are logistically impossible for a vast portion of the workforce. Standard AI wellness companions attempt to fill this void with generic personas. But an isolated older adult does not need a generalized digital assistant. They are experiencing the specific psychological ache of family separation. A generic bot cannot bridge a highly personal emotional gap. Aiko is a specialized intervention engineered to simulate a specific family relationship. By mimicking the voice and memories of a living relative, it establishes an ongoing relationship-specific loop rather than a sterile question-and-answer dynamic. Crucially, this system is not deployed as an unmonitored consumer gadget in the home. It is built strictly for supervised day service care facilities. This chart shows the massive scale of the Japanese day service market. Annual benefit payments scale up to 1.758 trillion yen, distributed across more than 43,500 active care offices nationwide. Managing over 43,000 separate offices requires a solution that integrates into existing administrative workflows rather than adding a separate layer of unmanaged consumer hardware. This diagram illustrates the core operational framework, a business-to-business-to-consumer deployment model. It maps the operational connection between the care facility, the family payer, and the elderly end user. Notice the care facility node. The facility acts as the primary distribution channel. They own the relationship with the older adult, physically host the hardware, and provide the necessary operational supervision. Moving to the family payer node, we see the adult-child's dual function in this system. They are the secondary financial payer subscribing to the service and the primary content provider, supplying the voice data and memories that fuel the platform. Standard direct-to-consumer approaches require heavy marketing spend to acquire individual elderly users. By distributing through institutional care networks, customer acquisition costs drop drastically. Inside these day service centers, operators face severe staff shortages and intense pressure to differentiate their daily activity programming to maintain enrollment. Aiko functions as a structured, supervised engagement activity. Because it operates autonomously during the session, it actively absorbs operational hours, reducing the daily burden on floor staff. Because the facility manages the physical setup, the older adult faces zero technological friction. There are no logins, no Wi-Fi troubleshooting, and no digital literacy barriers. By removing technical setup from the end user and providing direct ROI for the facility, the model addresses the specific friction points that have previously limited the adoption of assistive technology in care. Safely simulating a genuine family relationship requires a highly specialized technical pipeline. Data input begins with a 5 to 10 minute voice sample. The adult child provides this directly through a mobile app, completing the capture in one session. The voice synthesis pipeline then processes this audio. The resulting text-to-speech models are specifically tuned for elderly demographics, adjusting the acoustic output for age-appropriate hearing ranges, pacing, and clarity. This central LLM core illustrates the second data layer. Alongside the audio, the system ingests specific family history and communication styles. The model is fine-tuned on this proprietary data, outputting a continuous conversation that responds exactly like the family member. The AI maintains a continuous memory function. It recalls details from previous sessions, allowing it to build an ongoing, consistent narrative loop over months of daily use. A secondary engagement feature allows families to upload static photos. The system compiles these into video memory stories, fully narrated by the cloned voice, providing visual and auditory cognitive stimulation. To address the risk of deception, Aiko is explicitly positioned to the user as an asynchronous supplement to family contact. It is framed as an AI assistant speaking on behalf of the family, not a literal replacement for the living relative. Achieving true emotional resonance requires coupling highly accurate voice synthesis with deeply proprietary relationship data. This combination establishes a massive technological and operational moat. The highest barrier to entry for deploying AI voice technology in healthcare settings is navigating extreme ethical and data privacy risks. This tripartite consent matrix illustrates the system's foundational blueprint, built entirely around Japan's rigorous Act on the Protection of Personal Information, or APPI. It links the elderly user, the family contributor, and the facility operator through a central compliance gate. The matrix shows a sequential authorization workflow. All three parties, the user, the family contributor, and the facility, must provide digital confirmation before the system generates a voice model. As the digital boundary wall solidifies around the facility node, a strict licensing scope goes into effect. The voice clone is contractually trapped entirely within the supervised facility profile, preventing any external manipulation or extraction of the voice data. The system relies on mandatory cognitive safeguards. Care staff must perform clinical assessments to exclude users with advanced dementia from the platform, ensuring all participants can comprehend the AI nature of the interaction. Operational duty of care rules are hard-coded into the logic. The LLM is restricted by strict guardrails that outright prevent it from dispensing medical instructions or engaging in financial discussions. The entire backend utilizes strict role-based access control and immutable audit logging. Every interaction and data request is tracked, providing facility operators with absolute transparency and protection against liability. Rigorous enterprise-grade data governance is the primary requisite for unlocking B2B institutional deployment. This diagram maps the final operational ecosystem, visualizing the synchronization of three distinct user interfaces: a physical voice interface device, a mobile family portal, and a desktop facility dashboard, all linked by secure data flows. Zooming in on the voice interface node, the end-user hardware prioritizes an accessible, transparent, voice-first interaction design. It operates on a simplified, buttonless audio loop optimized for older adults. As the data flows outward, we move to the mobile family portal. This is the asynchronous engine where adult children upload new memories, review conversation summaries, and monitor engagement metrics from their smartphones. The system extracts non-diagnostic wellness insights from these interactions. Changes in conversational patterns, speech pacing, or topic repetition translate into objective updates delivered directly to the family portal. Finally, the data reaches the desktop facility dashboard. This serves as the centralized command and control center for day service staff on the floor. The dashboard consolidates individual engagement metrics across the entire facility population. It tracks active consent statuses, session durations, and overall system health in real time. Crucially, it provides a clear escalation pathway. If the system detects sudden shifts in mood or memory recall, the dashboard surfaces gentle alerts, prompting immediate human intervention by the nursing staff. The platform extracts its full value only when frictionless user experience, asynchronous family connection, and professional facility oversight are perfectly synchronized. This comparison matrix charts the competitive landscape, contrasting generic AI against Aiko's facility-integrated approach. Notice Aiko's placement in the upper right quadrant. While academic prototypes test family voice simulation in research, Aiko is a commercialized architecture built explicitly for institutional deployment. The platform's primary moat is data. The compounding value of proprietary, localized relationship data captured over months of use creates a deeply personalized asset that cannot be easily replicated by competitors. On the business side, embedding the software into the daily workflows of care staff creates high operational reliance and immense switching costs. The market timing aligns with Japan's expanding policy landscape. New cabinet-level priorities and direct government subsidies have been specifically allocated to combat elderly loneliness, providing immediate avenues for institutional procurement. Dominating Japan's hyper-aging market is the immediate objective. Securing this demographic provides the proof of concept required to scale the technology into global care markets. Aiko serves as a scalable infrastructure that integrates family presence directly into the future of institutional care.